Welcome, everyone. Thank you for coming. If anyone needs a folder, there's some up here. I think the main points that I'll initially talk on, and I think we get more out of if you have questions and answers, but are on this first blue page. So it just talks about why would you choose a certain clinic, and I think the main thing is that you want to choose a clinic that has high success rates and experience, high technology, experts in doing a lot of third party, especially with the international patients. Affordable care, I know finances are always an issue. And the one thing about our clinic, you do get more personal care. It's a medium to small size clinic, so you get more personalized care. And the staff that I have been there for 10 years, and they're very passionate about what they do. So it's a very comfortable environment, but you're not sacrificing any state-of-the-art technology. And we do have our in-house donors, so we have 75 donors that are on our list, and they're handpicked. And when you speak with our or email with our donor agent, she can help you. She'll say, these are the donors that I would recommend for the daddies because they make high egg make high number of eggs. Doesn't mean you have to pick that one, but we can certainly guide you. And the fact that we have our own donors makes a difference because you have a little bit of a history on those donors, and also they're medically screened. They're not from an agency. And then, so we have 7 local gestational care agencies. Idaho is a little bit more rural, so the women are fine. They want to be pregnant. It's very healthy and very conducive to pregnancy. We have experienced reproductive lawyers that have a passion for this, and Idaho is very, very, their laws are very conducive to gestational carrier agencies, or to gestational carrier. So there hasn't been any issues. We've had lots of daddies come through, and both daddies are on the passport and different nationalities, so it's not an issue. And we do have liaison services, which is kind of a small, point. And I can, depending on how you want me to direct the conversation, I can talk more about the medical process or about success rates or any questions that you have. Do you have questions about? So I guess I'll just start, what would you do initially to start? You would schedule a consultation either on the phone or by Skype. And then after you're established with the clinic, then you pick your donor and your carrier. The donor is in-house, so it's very easy. You work with Lindo, our donor coordinator, and she'd help you via email. And you get a full profile, so you get a sense of that person. And then with a carrier, then we would refer you to the 7 agencies, and usually it can take anywhere from 0 months to 6 months to find a carrier. It used to be it was very quick. You could find there were carriers waiting. Right, for some reason, there's been kind of an explosion with gestational carriers, so now people are having to wait up to 3 months, but it's usually not an issue. After that, then basically, when you pick your donor and your carrier, the clinic will coordinate everything. And we'll keep you apprised as to when the egg retrieval will be in the transfer and keep you updated with that information, but we'll coordinate everything. You would just need to come to Idaho for 2 days, and basically it would be to bank the sperm and to the infection screening, and to meet with a reproductive psychologist, which is guidelines for anyone going through third party, if it's donor egg, donor sperm, or gestational carrier. And then basically, we would do the transfer, and hopefully you'd get pregnant on that first transfer. If you transferred 2 embryos, non-PGS, it's about 65% live birth. Of those 65, 45 would be singleton, and 20 would be twins, and 1% would be triplets. And that's only if they both take in 1 splits. So we'd want you to be that 65%. If not, 50% of the time you'll have frozen embryos, so you'd get another chance. The average egg donor will make enough embryos that you'll have at least 2 embryo transfers. The lawyer, so once you pick the donor and the carrier, we'll coordinate the medical part. The lawyer will make a contract between you and the carrier. The lawyer will get the insurance between you and the carrier. And then once the carrier is pregnant, then the lawyer will either get an insurance policy for the baby, or will, if it's a non-eventful delivery, then you pay about $2,200 and just take the baby home without insurance. And the lawyer will get the documents for the home countries, no problem. You both are on the passport. And with whichever nationality, you always get a U.S. nationality, and then whichever nationality you are. We can talk about success rates or costs. Should we talk about both? That's usually what people want to hear about. It's very important. Typically, if you transfer, we've had high success rates. In 2014, we had 85% success rates per embryo transfer. On average, we'll transfer about 1.8 embryos. So there's more times when we're transferring 2 than 1, because if you transferred them equal, it'd be about average of 1.5. Our clinic is about 1.8, so it's more common to transfer 2 embryos. But we had 85% pregnancy rate per transfer. In those patients that transferred 1 embryo, the live birth rate was anywhere between 40 and 66%. So we've had high success rates, and as far as the cost goes, there's different package deals. I've made package deals more for the international patients because it's so confusing that you have to try to simplify things when you can, and still it's not as simple as I wish it was. But so typically if you buy one package deal where it's 1 egg harvest from the donor and 1 transfer, it's $25,000, but then you still have to pay for the donor meds, which are probably $3,000, so it ends up being $28,000. If you do the package deal where it's 1 transfer and then 1 retrieval and all the embryos transferred, then it's $30,000 plus the medication, so it's probably about $33,000. And if you do the unlimited, where you can get all retrievals and transfers within 3 years, that's $40,000. But then you have to pay for the medication 3 times, so there's almost $50,000 right there. The one caveat with the unlimited is that on the 3rd try that you'd have to pay the donor compensation also. The first 2 you don't have to, which is going to add another $3,000 for the donor compensation and $500 for anesthesia. So if you do the unlimited and you went out 3 retrievals and all the transfers in between, then you could be spending, I would say, so 40 is a package deal, plus 10 with the medication, plus 3,000 to 4,000, so it'd be $54,000 for that. It's an insurance policy. Either, you'll go home with a baby. But honestly, you shouldn't need to do that, because typically with most of the clinics, the success rates are above 50%. So most people are pregnant within 2 transfers. If you do fresh cycles, most of the egg donors will make between 15 and 25 eggs. The frozen eggs you can get from frozen egg banks, but they'll only give you 6 to 7 eggs. And usually 50% of the time, people are pregnant with 6 to 7 eggs and they don't have anything left. Another, I think, important information, 25 eggs sounds like a lot, but there's attrition rate each way. And typically from egg to blastocyst, it's a 5-to-1 ratio. So if you have 25 eggs, you'd expect around 5 blastocysts. And if we transfer 2 blastocysts, we'll get about 65% live birth rate, higher pregnancy rate, above 70%, but live birth rate about 65%. So you want to be that 65% that goes home with a baby, but there's 35% that didn't. If you're that 35% that didn't, let's say we had 5 blastocysts, we transferred 2, there's still 3 left, then we can transfer 2 again. And from those 65, another 60% will get pregnant. So you're going to be down to, 25 that don't have a baby. So a lot depends on how many high-quality blastocysts you have. And the PGS is a way to get more information about the embryos. I'm not one of those people I'm not stuck on PGS at all. I don't push it. It's one of those things, if you're trying to transfer 1 embryo, it may give you more confidence in that 1 embryo. Or you can go, if you have lots of embryos and you're really trying to be efficient about which ones to transfer, then it may make sense, because otherwise you're probably going to get pregnant within the first 2 transfers and you have these extra embryos that are frozen. And the first year of storage is paid for, but after that you have to pay $500 per year of storing the embryos. So in one way, it's an efficient way, so if you're not freezing false hope. But I'm one that, I don't push PGS with the egg donors. Now with women that are older, I do, because there's a higher percentage of those embryos are abnormal. Does anyone have questions about, let's see, medical logistics or success rates or cost? I'm trying to think of other questions. I know people always have questions about the insurance, and that's more for the lawyers, but I can try to answer that. You'd end up staying in the U.S. when the babies are born about 2.5 to 3 weeks to get the home country documents and passport done. But often people will come early because they want to be there before the birth, and they may be waiting 1 or 2 weeks, and then they have to spend another 2-3 weeks. But I don't know, I think it's reasonable once the baby's born just to come and not to wait for a month. I don't know, probably a lot of people ask me, where is Idaho? If you're looking at the state of the U.S., there's California, then Nevada, and then Idaho. So it's in the Pacific Northwest. It's more like a mountain town, more rural, more recreation. It's about 1 hour flight from San Francisco, Portland, and Seattle, and about a 2-hour flight from Denver. Does anyone have any questions or? Mm-hmm. They are. Right, and that's what makes it, I think, so easy, because it's like a one-stop shop. Everything's very local. The donors are actually in our office. We have 75 donors. The carriers are a separate company, but we work with 7 agencies, and they're all very local. So everything's done right there. And then the reproductive lawyer is local. She's right down the street from me. There's 2 lawyers, and then the psychologist is right down the street also. So everything's very convenient, within 15 minutes of each other. Well, I feel like you probably had so much information. You're ready for some wine, right? I think everyone is, yeah. Okay, thank you.